COVID-19 has been a devastating pandemic that has affected the entire world. And it's had tremendous impact here in Maryland, and particularly amongst African Americans or people of color.
It definitely was fear, uncertainty, not sure what was going to happen. It was something that I couldn't see, that I could, you know, that I could get.
So many things to say about it. I remember when it first started, it felt so surreal just to feel that everything was shutting down and isolated, and that was the scariest thing for me, is being isolated. My first visceral reaction to it was just to like kind of ignore it, but then all these people started getting sick around me, and they were really starting to take things seriously, and then before I know it, they're starting to take things from me. Can't go outside, can't go to restaurants, can't find anything. It was crazy.
It changed a whole lot for everybody. Working from home now, businesses closing, people are losing money, losing their homes. It was very traumatic.
The COVID-19 pandemic has been a horrible tragedy for Maryland and for the world at large. Its impact on Maryland has been huge, especially over the past year. It's been almost devastating at times, especially over the winter, but we are looking optimistically towards the light at the end of the tunnel, and looking forward to a better future and getting our lives back.
If we want to get back to normalcy, I think everyone should be vaccinated. And the sooner we do so, the sooner we can go back to visiting our friends, our families, being able to travel without having to wear a mask and to social distance. I think the vaccines are safe and effective because one, it helps prevent serious infections, decreasing the rate of hospital admissions, ICU admissions. And if you were to be exposed to COVID-19, it will not be as severe.
Because I've had the vaccine and I have the antibodies to prove it. So yes, the vaccine is safe and it is extremely effective. Moderna especially, over 92% effective. So I strongly encourage and recommend that everybody listening to this and seeing this get the vaccine.
I think that's one of the things about COVID that people don't seem to really get, that it's not just about you protecting yourself by wearing a mask, but it's also about you protecting the people around you, your community. And if you love your community, your nation so much, I can't understand why you wouldn't want to protect yourself or your citizens around you. So as for Maryland, and as well as the entire nation and world for that matter, everyone should get it if it's available to them, once it's available to them.
I mean, I've gotten my vaccine. I had no issues, really. I was a little sluggish on the second one. But other than that, I think it's just important because, I don't know, we just want to move forward and get past all of this.
I was a little leery about it in the beginning, but I know by me working in the public's sight, I know that I had to protect myself and my family and my loved ones. I just have great belief that the medication, the vaccine, that I believe that they took every precaution to make sure this would be effective so that no harm will come to the human race.
I was a little fearful at first, of course, because I didn't know, I thought maybe this is too soon. How do they really know that it's going to work? But then I think about technology and how it has evolved. And it's not the same as it was back then. So I figured if we walk in a place every day not knowing if we touch something that we could attain or attract the virus, what harm would it do to get the vaccine? I mean, other than the fear of, contracting it and having the virus inside of you. So you cannot see it, so you don't know if you can contract it. Sometimes you won't know that you have it, and just spreading it to other people, like the surges are crazy, and it doesn't respect a person. Like it's anybody can get it.
It's really important for us to all consider getting the vaccine so that we may get our lives back, so that we can have herd immunity by the end of the summer and potentially send all our children back to school, be able to travel, see our families, hold them, hug them, and essentially get back to normal, whatever that means. I think about the patients I've lost. I think about the impact it had when the pandemic first started in March. I think about my patients who are intubated right now in the ICU in hospitals across Maryland, and I think that should not be lost on what this impact has had and the pandemic has had on the lives of all our patients and ourselves.
I guess just to think about the emotional impact this is going to have on a whole generation of kids, on a whole bunch of people that have been, dealing with this. A lot of, again, the minimum wage workers that are kind of recouped from this, people that have lost their homes, the recovering community, how much devastation this has caused for them. Again, not being able to see their therapists, lots of relapses, our teenagers, lots of suicide, the suicide rates having escalated with high schoolers, kids being isolated, whole community populations being isolated. So just dealing with the aftermath, the pandemic, the virus itself is one thing, but we've got a whole lot of work to do.
I believe that we as a people should love and respect each other, do what is required of us, and just go on with our lives. And the most important thing, to keep God first.
And in your opinion, what's the best way to slow down COVID-19?
Wear a mask, wash your hands, keep your distance. Wear a mask, wash your hands, keep your distance, and get the vaccine if you can.